Hey, we got a gunshot.
GSW chest.
Where?
RTO's down. GSW chest.
Left.
What's the injuries?
This is a recreation of a battalion aid station. The first place where soldiers injured in combat might be transferred to receive medical care. And while all the injuries you see here are simulated on dummies or fellow trainees, the main element this training recreates is the stress of being a combat medic in the field.
You're tired, you're working all day, every day, it's hot outside. It's just kind of relentless after a while. You just gotta keep motivated.
The most difficult part for everybody would be the sleep deprivation.
Dealing with that stress is the biggest obstacle for these future combat medics. After basic and 15 more weeks of medical training, trainees find themselves here in the 8-day final test called the field training exercise, where they'll have to be ready to use everything they've learned.
There's a reason why this course is so intense, is because we're trying to prepare them for the rigors of battle. Without that little bit of stress every day, they're not going to be prepared for actual combat.
The culminating field training exercise consists of 3 parts.
Hey, talk to us.
Dismounted patrol,
We need to maintain pressure on this exotic wound. Let's
a
go.
battalion aid station,
Once he gets blood, I'm sure respiratory rate will drop.
and prolonged casualty care. Because combat medics are trained like any other Army soldier, during dismounted patrol, students are tasked with a tactical mission where they'll eventually come upon wounded soldiers.
Push up!
You need to push forward.
On your feet. Push up. Push up. On your feet. Push up. Push up. Push up.
And react accordingly to any threats that arise.
During large-scale combat operations, they're going to have to know how to move thoroughly and how to maneuver properly in order to save lives.
Nugent!
What?
Come here.
Hey, secure this scene.
When the students come upon a casualty, the first thing they have to do is determine what type of care to give. Something they learn to assess in the second phase of training, which is focused on casualty combat care.
I need a medic.
So you're gonna open up their gear, open up their top all the way down to their brown t-shirt. We start teaching it this early in the course because there's so much that goes into it, they need a lot of time to practice.
Controlled casualty assessments, or CCAs, are a process that combat medics use to assess trauma casualties.
Hurry up and get down here! So we start with them carrying their fire. They go out there, get fire superiority, make sure there's no obvious bleeding on the arms or the legs. If there is, they put a tourniquet on, they drag them what we call off the X. They drag them off the X and into tactical field care. Let's go, get off the X!
When assessing a casualty, students are taught to follow the mnemonic device MARCH, which stands for massive hemorrhage, airway, respiration, circulation, and hypothermia.
You're gonna start with your blood sweep. If I see blood, I'll pack it. They start with a blood sweep from the neck all the way down to make sure they control the bleeding. Hey, can you hear me? Can you hear me? Then they go to airway, making sure that their airway is open. And then they go down to respiration, so they open up all their gear, look at the chest wall, and make sure there's no holes there.
For holes all the way down.
Look at the back, make sure there's no injuries over there. They move on to circulation, make sure that they have a pulse, what we call radial pulse, down there in their wrist. And they go down to hypothermia, so we're always making sure that we keep our casualties warm, so we wrap them up in a blanket. And then we move into tactical evacuation care. At this time, the medic should be at the head of the litter. The security should be at the foot. And you're getting ready to take your casualty to the HLZ. Then they're just reassessing at that point, making sure that all the interventions that they have done are still working. They'll start giving pain medications if they need it, antibiotics if the casualty needs it, while we're waiting for the bird or the vehicle to come get the casualty out of there.
Actually seeing somebody getting hurt in combat is extremely stressful. But if you have that muscle memory, because you've done this skill over and over and over again, it's like tying your shoes. You don't have to think about tying your shoes, you just do it.
I need y'all to get a CCP set up now.
In the perimeter. Come on, Louis.
Yes,
I'm pretty sure they're tired, they're stressed out, they want to fight each other, they want to be in the comfort of their own homes. But again, it's training, retrain to fight, and this is what we do.
Once the students stabilize their patients, they evacuate them to safety and to receive further treatment. When casualties are evacuated from combat, they're taken to a battalion aid station, the second portion of the field training exercise.
Sir, can we get pulse and SpO2, please?
So they're expected to triage casualties, get them into the aid station, get them treated by doing their combat casualty assessment and treating any life-threatening injuries, and get them stabilized to move to the next highest level of care.
They can't feel your radio pulse. We can't feel his radio pulse because so we're gonna have to do IO.
We throw all kinds of different patients. We start out with sick call patients, patients with normal everyday illnesses or injuries. We see trauma patients from amputations to gunshot wounds to abdominal evisceration.
It's gonna be what, 1 milligram. So we're gonna give her 100 off the bat.
They are pretty physically tested. They just get bombarded with patients sometimes, and it's exhausting. And then after a few days, or even after the 12 hours that they're on shift or 16 hours that they're on shift, they just get tired.
All right, he's got abdominal evisceration and left leg amputation.
We're working on 4 to 5 hours of sleep a night, if that, because in a realistic world, medics will not have that much sleep because we're going to have patients nonstop.
The patients students treat in this portion of the field exercise are represented by these high-fidelity mannequins that trainees first encountered earlier in their training.
Do I have pressure yet?
Nope. Yeah, for a millisecond.
We teach them how to be able to pack junctional bleeds, how to put on tourniquets. But with these mannequins here, they're able to see, okay, here's how tight I need to have a tourniquet, how much pressure I need to hold into packing a junctional wound.
Once it's pretty much packed, that's when you pile the rest in, and your body weight for the medics, your body weight is what's gonna help you. You do not, if you're just over here like this, it's gonna keep bleeding.
The mannequins the students work with are able to move, breathe, and bleed, and even offer real-time feedback.
So that controller shows all the vitals of the casualties. Once they start packing a wound, it shows if they're holding enough pressure to be able to stop that bleed. If they're putting on a tourniquet, it shows if they're having enough pressure on that tourniquet to be able to stop that bleed.
Bleeding control, extremities.
Once we were able to give them that real-time feedback, they know, all right, that's how much pressure I need to apply every time. This is exactly what I need to do to actually save a life on combat environment.
Working with these mannequins is very interesting. They act very much like a real person, so it can be a little bit intimidating when you first come up to one, because it is our first time really working with something like this, as opposed to just having, somebody else just laying on the ground and you're just sort of going through the motions. It makes it a lot more real.
Get his armor off.
Training gets even more realistic when students are put through a simulated combat scenario in which they have to find and treat their assigned casualty within a certain amount of time. Doing so in near total darkness and surrounded by the sounds of battle.
It's important for the soldier medics to be put under these stressors because they're not always going to be put in ideal situations when having to apply these interventions.
It was a pretty stressful environment coming in. There was a lot of flashing lights and it was pretty dark and very loud. Simulated very much a real combat environment.
Put his arm up and over. Ready? Arm up and over. Arm up and over.
When trainees approach a mannequin, they perform a casualty assessment, following the march procedure they learned earlier in training, and work to stop any bleeding as quickly as possible.
Hurry up, move quickly.
All while instructors monitor from eyes in the sky.
In my control room, I'm able to see what everybody's doing. If you were to look around, you see that I have 16 cameras throughout my lab, so I can actually direct them right on to where my casualties are, so I can actually get a better view.
The mannequins also send real-time vital signs information to instructors so they can monitor the students' performance.
I'll be able to see their heart rate, blood pressure, respiratory rate, their end-tidal CO2s. It'll show me that they're still bleeding. It'll show me whether the bleeding is controlled and the time that it was controlled. This one here, they've been maintaining pressure, so they've almost got the bleeding controlled because they've been holding it for 3 minutes. This one's close, but that one didn't make it. He died on it. He bled out.
How long was he bleeding from femoral artery?
About 2 minutes.
No, like 7 minutes. Till almost the end of your assessment. Your patient died. And then he stopped bleeding.
I take notes as I'm doing it, so that way when I do a debriefing, I can actually come out and tell them, like, hey, your patient died at this time. This is what they died from.
The mistakes students make at this point will act as valuable lessons as they move on through their training.
How much blood do you think collected up in here, and then while you're putting pressure, squeezed out of it? A lot, right? You think that's enough to kill this guy? Enough blood loss to kill this guy? Yeah.
I didn't know they were going to bleed that much. What was really hard about it was actually putting the amount of pressure to stop the bleeding. So assessing bleeding control is super important.
I think the big thing was communication, right? When you guys first came in, you were both working on the same injury at the same time, right? There's multiple medics, so you can work on multiple injuries, right? Just communicate, make sure you're on the same page, make sure you're doing multiple things.
Teamwork is extremely important. It's important to stay calm and be able to communicate what you need done for the patient with your partner to make sure that everybody's on the same page and everybody's sticking to life-saving measures that need to be taken.
They're taught in the whiskey portion of the program to treat patients as one person, and we teach them here in the aid station it's not just one person, it's a team effort where you're treating one injury and I'll treat the other injury, or you're getting vital signs and I'm giving an IV.
Go for it. We got the patient. We got to start wrapping that axillary. Go!
The third block of the field training exercise is the prolonged casualty care lane, where students perform more advanced procedures and have to care for patients for an extended period of time.
Is this bag with the wide tubing for blood getting ready for blood?
Instead of having medical evacuation assets available to you in the next hour or 2 hours, we want them to start thinking, I've done this, and then what? So if evacuation is delayed for 1 hour or 2 hours or a day or 2 days, it's asking what else can I do for this patient?
I don't have rise and fall from this side of the chest.
Okay,
So
give it a minute. This isn't going to be simultaneous. We're not going to seal it and then he's going to start breathing again.
We have a patient that is brought in from patrol. They may or may not have all their injuries substantially taken care of, so therefore they're brought to us. We have to package them, get any life-saving interventions going through a specific algorithm. We're doing it under a high-stress environment, low light, simulating an area that is far away from home. Supplies may be limited, manpower may be limited, and you have to do everything you can and meet your evac time.
So, at 140, blood pressure 140 over 70.
High-fidelity mannequins are again used, and they offer real-time feedback on their vital signs.
Are his eyes moving? Is he responding to light?
Yeah, they're dilute, or
Is he responding to light, yes or no?
You have someone that's on the head that's usually your lead person. They are the one calling the shots, calling the movements, repeating back what they need, if they need any interventions, any medications.
All right, give me another roll. Another roll?
Another roll.
Another roll, come back out.
And then after that, you will have people on each side, designated spots of the body, left upper hemisphere, left lower hemisphere, that type of thing. Overall, it just creates for a better teamwork environment.
You got what looks like a laceration abrasion on the left hip.
Yes.
Left hip front.
Hey,
And then another laceration left thigh.
Students will spend around 4 hours treating each patient using techniques and procedures they learned during the first phase of their training. They get an introduction to emergency medicine early on in training as part of becoming EMT certified.
Challenges that students face in this portion of student training is a fire hose of information tasked with skills that they're performing for the first time. So that high stakes testing and situation that they're in really provides them with a very good backbone for the future of their medical careers.
And one swift motion, a stab till you hear the click. One.
They throw a lot at you, so it's a lot of memorization and just being able to think critically and think quickly and be effective.
Sir, please go ahead and stop chest compressions. Go ahead and assess carotid pulse and breathing.
It all leads up to the NREMT exam, a 2-part certification process that all students must complete before moving on with their training.
It represents a national standard of excellence, and we ask the same thing for our healthcare providers, our doctors, our nurses. All of them have to meet national standards and board certification, and we require our medics to have that same standard.
And you are going to inflate the balloon, all 10 milliliters of air.
The injuries that we're teaching them to treat would be anything that interferes with the movement of air in and out of the body. Whether that be that they inhaled superheated air or they have some sort of maxillofacial trauma, we teach them to mitigate or even bypass that oropharynx so that air can still move into the lungs.
5.
During the field training exercise, students need to know several procedures for treating injuries to a patient's airway. And one of the more complicated procedures future combat medics learn is how to perform the cricothyrotomy, which might be required if a soldier sustains an injury to the face or lungs.
Scalpel. Sharps!
Students first practice performing a cricothyrotomy on a mannequin before moving on to real tissue in the form of a pig trachea.
All right, we're gonna put it, nope, you want it to go in this way, right? Because we're trying to go this way.
I really enjoyed the pig because it was like an actual, trachea and stuff. So I got to feel how a real one, like the anatomy feels.
Feel that roll into the trachea. You're trying to push down. Don't push down because that's why you're not getting air.
What we're doing right now is just giving them tools and skills, and then later on when they do their field training exercise, they will actually have them start thinking outside of the box. What kind of things do you do when you don't have that surgical cric? How are you going to maintain that airway and get that oxygenation level back up?
And he's going to keep rocking that bag.
One of the final procedures students learn in training is also one of the newest additions to the program: how to perform an autologous blood transfusion.
A situation a student may find themselves in an operational setting where they might need to administer fresh whole blood is a patient that's hemorrhaging and has lost a significant portion of blood and is in hypovolemic shock or hemorrhagic shock. And what we're going to do is we're going to return that blood product back into them, preferably fresh whole blood, in order to get return of radial pulses and get them into a normotensive status.
So I'm going to go right here, and we go right here.
After several lectures, the students observe an instructor demonstration before practicing on a training simulator.
So I think initially they definitely have some butterflies, but once they see the instructors do it, you see the arms behind us, they get to practice on the arms before they practice on a live patient. I think that kind of fades away, and I think they're excited.
Finally, the students practice performing the procedure on each other.
It was nerve-wracking. I was doing it on a friend of mine, and I just kept thinking, man, it'd be really awkward if I did something wrong. I mean, how did you talk about that? Bring that up afterwards, like, hey, I'm totally sorry, I forgot to tie off the blood bag, but it's cool.
In my head, I was just like, please don't kill her, please don't kill her. I was just trying to make sure, like, I got everything precise. At the end of the day, I got it, didn't lose any extra blood. She was fine, and it went well.
When you're doing blood transfusions, you have to make sure that you're watching their vitals. You have to continuously stay on top of it. There's a lot of moving parts to it that need to be done simultaneously and continuously.
Did you ever think you'd be capable of performing a blood transfusion?
No, not at all. Especially when I was doing it, I was like, I kept thinking of everything I could possibly do to do it wrong. I'm like, maybe I'll do this and this will be wrong. So I never thought I'd be capable of doing it, but once I did, just kind of smooth sailing from there.
As soon as he plugs that in, let's go.
In the culminating field training exercise, students don't know which of the procedures they'll have to use, which is why they have to be prepared for all the ones they've learned in training.
There's an expectation that they're going to stumble a bit, but as long as we can watch that group and watch them kind of think through the problem and start looking around their setting and being like, what other tools do I have available that I can use to help this patient along? And if I don't have exactly what I need, what can I do to kind of make that happen?
10cc flush.
When did you throw that tourniquet on?
Tourniquet was on probably 5 minutes ago.
For me, it literally just draws me in. I'm focused on what I need to do. What's going on right there in front of me is what needs to be done. So for me, I'm at home.
In my opinion, they view this as the best part of their training. They actually get to see what they've learned in the classroom actually get put into action.
I feel really accomplished. It's been hard, but it's been really rewarding too. It's just crazy to think that I made it this far, and I'm proud of myself. I'm proud of all my battle buddies, and we're all doing really well.
After surviving the field training exercise, the students depart from Camp Bullis with a 4-mile ruck march at sunrise, symbolizing the end of their training. Most of the graduates will return to their home station, either in the National Guard or the Army Reserve. The rest will be assigned to their next post in the active duty force.
When you look at the future operating environment and what that beholds with near-peer adversaries and a higher op-tempo environment, an environment that will require prolonged field care in some cases, Army medics, the training that is conducted with them is far greater and more impactful than it ever has been.
Life is finite, and you don't always know if you're guaranteed tomorrow. You may go out on a patrol one day, nothing happened. You go on a patrol the next day, you're getting shot at, you're taking casualties, and your battle buddy's relying on you. And no matter what, you're going to do what you can to get your battle buddy home.